everyone. I'm Molly Lindquist, part of the Manta Cares team, and I want to welcome you to our Patient from Hell podcast club. The purpose of the Patient from Hell PCORI episodes, funded by the Patient-Centered Outcomes Research Institute, is to bring PCORI-funded researchers onto the podcast to share about their research so more of us can learn about it and use it to help us in our own lives as patients or care partners. I say our because I myself am a breast cancer survivor, so I've been there too. So what is a podcast club, you may be thinking? Well, think book club, but for podcasts where we discuss and learn together. Today, I'm super excited to introduce our nonprofit partner organization, the Mike Slive Foundation. We're going to hear from Emily Capilouto, the Director of Education and Outreach for the Foundation, to learn more about the great work they're doing. Then we have the pleasure of chatting with Mr. Charles Latham, a prostate cancer survivor who will share his story and then talk a little bit about his thoughts on our PCORI episode, The Evolution of Prostate Cancer Care with Dr. David Penson of Vanderbilt University. So without further ado, I'm going to hand it over to Emily to tell us a bit about the Mike Slive Foundation.
Hi, I'm Emily Capilouto. I am the Director of Education and Outreach for the Mike Slive Foundation for Prostate Cancer Research. We were founded in 2017 by Mike Slive, the former commissioner of the Southeastern Conference. Mike changed the game for collegiate athletics, and in his retirement, he wanted to do the same thing for prostate cancer. Unfortunately, 6 months after founding our organization, Mike had a reoccurrence and passed away from prostate cancer. We strive to uphold his vision and mission every day by educating men and their families about prostate cancer and early detection, and by funding cutting-edge research. So to date, we have funded 27 pilot grants for innovative research, and we plan to add to that total number by the end of the year as our grant cycle is currently open. So we have a lot of wonderful people involved in our organization, and I'm so glad that I get to introduce Mr. Charles Latham to you today.
Love it, Emily. Can you actually tell us a little bit about Charles? I know you know him pretty well.
I would love to. Charles is one of our amazing board members of the Mike Slive Foundation, and he is a prostate cancer survivor that we are so thankful widely shares his story with men and across his community. Charles is not only involved in our organization, but he is also part of the UAB, the University of Alabama at Birmingham, Community and Outreach and Engagement and Advisory Committee. So he's a member there. He's currently participating, as you can see from what he's wearing, in their Hey Fellows program, where he's a community health advisor, and he's doing peer-to-peer education with men in his community about prostate cancer and about getting screened. And he is the representative for his community in Grenada, but that is a program that's operating over 26 counties across Alabama and Mississippi, and the Mike Slive Foundation is proud to be a co-supporter of that program. Charles is also the Health and Wellness Chair of 100 Black Men of Grenada, where he not only is a member of that organization, but also the Mike Slive Foundation recently put on a prostate cancer awareness walk, the first annual of its kind, which was very successful as well. So Charles is not only a wonderful advocate who shares his story, but he is active in his community, making sure that men and their families learn about prostate cancer and early detection.
Charles, how are there enough hours in the day for you to do all that work? That's amazing.
First off, I'd like to thank you, Emily, for that great introduction. You know, it may be hard for me to live up to what you just put me up to, but I'm truly a blessed individual. You know, I spent 25 years working for the federal government, 4 of which I was in the United States Marine Corps. And just a little bit to tell you about my story. Start right there. Here I was, you know, I was getting ready to retire from working for the Navy for 25. This is way back in 2003. So here I was, 50 years old, looking forward to my retirement to move back down here to Mississippi. So I go in for a routine checkup. You know, here I'm in California. I'm familiar with my doctors, the hospital, so I wanted to get all this done before I moved to Mississippi because I wasn't quite sure of what the healthcare system was down here. Would I get the same quality care and all that, So I just went in for a routine check. Well, when I went in for the routine check, my PSA numbers came back high, and I'm thinking I don't even know what PSA is, but I later found out, of course, it's prostate specific antigen gene in your blood that tells you about your prostate cancer levels. So I went on in and said they recommended that I do a biopsy. And I tell you one thing, every man who's gone through this know exactly how many times that needle hit them during that biopsy. Mine hit me 11 times. 11 times it hit me. But out of those 11 samples they took from me, prostate cancer was only detected in one of those samples, and it was only 10% of that one sample. So the doctor still had to tell me those three dreaded words, Molly, that I know you've heard. You have cancer. Doesn't matter which kind of cancer it is. Those words are devastating to an individual. I still can't remember the ride home, Molly, that day. Because here I am, I'm 50. I'm thinking I'm going to die. They just told me I had cancer. I'm wondering, how am I going to tell my wife? How am I going to tell my children? All this is what I'm thinking when I'm driving home. I don't remember the ride. All I know is I ended up home. And I got home before everyone, and I finally told my family, Well, to make a long story short, I went on and decided to get that cancer out of my body. They have these new techniques now that were not available at the time. But I knew one guy told me, man, don't do anything stupid. Get that cancer out your body. So I went and had a radical prostatectomy, which was a nerve sparing procedure, and they went on and removed my prostate. And I tell folks, Molly and Emily, that getting prostate cancer was twofold. It was number one, the worst thing that ever happened to me in my life. It was the absolute worst thing, worst news I could have ever got. But it turns out to also be the best thing that ever happened to me. Because, see, it, number one, saved my life. Okay? Saved my life. And when at that moment in 2003, by the way, September the 5th was 20 years that I've been cancer free. September the 5th. So I had no idea 20 years how God would use me. How he would bring all us together, because he done brought us together here, the three of us talking, and all the people who are listening to us, because somebody listening to us today is going to be saved. I'm here to tell you that. So I didn't know that all I did was come back to Grenada, and I started telling people about how God saved me from prostate cancer and that, and other men start coming up asking me questions. Turned out to be about 25 different men that come up to ask me about prostate cancer and my own experience. Well, all that led to the University of Alabama folks taking notice and wanting me to be a part of their community outreach engagement. So God blessed me to be on that. I just get on there and do what I can. Tell the same story. By me being on there, Emily and them saw me with the Mike Slive in the work that I was doing. So they invited me to be participated with them. I'm thinking, this is God just putting me. He'll save my life now. Because I asked him, why did you save my life? And he said, so you can help save others. And we don't know how he's going to use us. But by me telling that story, I ended up meeting beautiful, wonderful Emily and Anna. And oh my God, I was just talking to another guy who's a community health advisor here in Grenada after we had the Onward Mike walk the other day. I said to him, God's going to keep putting you in places where people can hear you. And oh my God, the next day I get something from Emily telling me about introducing me to Molly and Samara. And here we are. Here we are. And there are people on the East Coast, on West Coast rather, East Coast and all over, who are hearing our stories. And hopefully someone going to be saved. Emily, you know that video I posted the other day about prostate cancer awareness? I did it on my social media page. Well, a guy from Nigeria reshared my page and said, sir, you are absolutely right. He says, I have prostate cancer, but I waited too late. It spread it throughout my body. Oh my God. I already know what's going to happen to him. But the fact that he is now spreading my video, he's spreading the word out there, telling other men, you need to go get yourself checked. It's it's gonna save someone else's life, and I'm 100% convinced of that. And I thank God for this opportunity. I'm gonna continue to let him use me. I ain't no preacher now, but I'm the preacher, non-preacher that you're gonna ever meet, because I don't hesitate to tell folks it's all God. Everything that's happened to me is because of him. Meeting y'all is because of him. The lives that we're going to save today by reaching out to other people who are listening to this, it's going to save someone. It's all because of God putting all of us together. And I can't tell you how much I appreciate this opportunity. And I'm gonna try to be quiet now and wait for y'all to ask
No.
me any questions.
No, I love it, Charles. I love how you have taken your own experience and, through your relationship with God, found meaning, purpose. And to your point, you're really just paying it forward and helping so many other people by being open. I think, I don't know if you felt this way in that fog when you described your ride home. I remembered my same ride home where I'm like, how did I get back here? I have no idea. But, again, once you kind of find your voice and are able to use that, I just think that is incredibly meaningful. So I'm hoping you had a chance to listen to Dr. Penson's episode about prostate cancer, Emily. Do you have any thoughts or responses to the podcast?
Yes, I found everything that he had to say to be very interesting and really in line with what we experience as we work with survivors and also supporting research in the area of prostate cancer. First and foremost, he mentioned this debate about the PSA test and how it is, in fact, debated insofar as it's not a perfect screening tool. And we understand that. And we, for that reason, sort of in line with other organizations, we encourage men to speak to their doctor, to know their family history, and to have those discussions with their care provider. Because when you need to be tested and with what screening test really comes down to a lot of different factors, including if you have a history of cancer yourself, if you have a history of not only prostate cancer, but certain cancers in your family. And, as Charles will touch on, he's one of many in his family that have had prostate cancer. And so a PSA test, saved Charles's life, but it can also be really helpful if you do have this familial history of cancer in your family as well. But it is important to have that conversation with your doctor. What age you need to be tested at will change, as well as if the PSA or if another screening test, like some of the imaging that he mentioned, or if you are a better candidate for the digital rectal exam. So I thought that really rang true to what we encourage men in our community to do. And so I was glad to hear that discussed. I also thought it was really interesting that he brought up this discussion about the debate sort of comparison more between breast cancer and prostate cancer. So these are similar in many ways. These are cancers that primarily happen to, men, individuals with prostates, and then also overwhelmingly happen to women, although not always, with breast cancer. And how looking at both of these have a lot of issues tied to them that are not simply the cancer. It's about feeling, like you're a man or a woman in the correct ways, your sexuality, all of these sorts of things. And so looking at how breast cancer, the dialogue around it and the stigma reduction around breast cancer in the last 25 years has really led to, as discussed in the episode, this changing in research support. And then as a result, much more science, much more data. So not only individuals and patients, but also their care providers can make better collective decisions when deciding about breast cancer care, treatment, and then survivorship. And as the podcast discussed, prostate cancer is really behind. We're lagging. We are 20 years behind where breast cancer is. And so as we begin to, hopefully through things like education and people like Charles sharing their story, really help reduce that stigma. The Mike Slive Foundation also believes in really supporting that research, because we really want to close that gap. We want men to know their different options for surgery. Some men do a watch and wait. So we want that to be an informed decision with their care team and their families. We want data behind that. We want data behind your treatment options and your treatments. And then we want to give you a lot of treatment and continuing care options for quality of life. So I'm really glad that they touched upon all of those aspects in the podcast, because those two we definitely talk a lot about here, and Charles can speak more to those as well.
If I may say, Molly, on Emily's point, prostate cancer and breast cancer, to me, you know, they are close, because breast cancer affects how a woman feels about herself, you know, about her body,
Yep.
how she feels sexually, if you will.
Mm-hmm.
And prostate cancer affect men in the same way, because a man feels that he's now diminished in that area. And that's a tough pill for most men to swallow. See, that's a real tough swing. And so I have to tell men, I have to make this point very clear. Because most of the men, and I'm going to try to be as respectful as I can with this, but I got to be honest, because this is what Hey Fellas is all about. It's all about men having a frank conversation about prostate cancer. Most men are reluctant to go and get the exam because, you know, the DRE, digital rectal exam, is one of the tools used to detect the prostate cancer. You know, they're going to do that. And the other is the PSA. And there's other methods to do it, but we have to not be afraid. We men, I'm talking to the men now who are listening. We have to not be afraid of a digital rectal exam. We have to not be afraid of a blood test. We have to not be afraid of anything that's going to keep us around for the people who are counting on us. Your mother, if you're a son, is counting on you. If you're a husband, your wife is counting on you. If you're a father, your children are counting on you. Some of us are grandfathers when we find out. Your grandchildren are counting on you. There are many people in your family who are counting on you. And if it takes a slight discomfort of someone doing something to you just for a moment or two you're uncomfortable with, think about them and don't think about yourself. Think about the people who are counting on you, because I tell a story about the 25 men that I talked to, and their own doctors say that by them following my recommendation and advice, it saved their life. That's what their doctor said.
Wow.
But I also have to talk about my one classmate who didn't listen, who told me to tell his story, by the way. And I'll tell the story if we have time. At my 35-year class reunion, people were making presentations to me, and I was up speaking about certain things and talking about how I had survived prostate cancer. And one of my classmates, that was in June. So in September, I saw him, and he says to me, "Charles, did you see me the night that you were up speaking at the reunion when I went outside?" I said, "No, Jimmy, I didn't see you. What happened?" He says, "Well, I was crying," he said. He says, "Because when you was up there brave enough to tell your story," he said, "I had just learned 2 weeks before then, my doctor has told me 2 weeks before then that I had prostate cancer." You see. But Jimmy was married to a younger woman, you see, and he thought it was going to affect his life adversely sexually. So he didn't do anything. That was in September when I saw him. I called him up because when he said, much like the Nigerian guy said, that it spread to other parts, I already knew what that meant, you know. So all I could do is be supportive. I started calling him every month. He was progressively getting worse. Then I started calling him every 2 weeks. And I remember in December of that year, I called him about the second week in December. He was crying. He was in excruciating pain. And he says, "Man, Charles, tell my story." He said, "I should have listened to you, I would admit." And I know that had I not listened to folks, I would have been dead 19 years ago. That cancer took him out so quickly, because people need to understand. that the prostate is only about the size of a walnut. And once it gets outside what is known as the capsule, it could hit your lymph nodes. It could go anywhere. I'm not a doctor, but I'm a person who would have survived, and I can tell you that if it gets in your lymph nodes, you have some problems. You have some problems. So let's do everything we can, men. I don't care how uncomfortable it is. Let's do everything we can. If not for yourself, for the people who love you. Because I'm going to tell you, and I'm going to say this, and I'm going to be done with it, men. Better listen. You cannot have sex, no way, if you dead. You understand that? If you're dead, sex is over.
Right.
But if you're alive, there are things that they can do. Talk about technology. A lot of things unchanged. And I'm happy to say 20 years later, I ain't going to get too deep in what me and my honey do. But 10 years later, I'm a happy man and she's a happy woman. And speaking of that, one more thing, guys, you must know. You must know. If you got a wife, woman, girlfriend, or whatever, that sticks with you throughout prostate cancer, you need to fall on your knees and thank God you got her. You understand? Because you got a sexual problem, and this woman's still with you. She's still with you. My wife helped me through it. She helped me through it. I couldn't have made it without her. She stroked my ego when I needed. She took care of me. She fed me. She took care of me. See, she took care of me, and I thank God for her. So, if you guys don't take anything else, don't be afraid to go get yourself checked and do it for the other people who are counting on you.
Love that, Charles. Thank you. I think that sums it up beautifully. I want to thank both of you so much for being a part of this podcast club. Emily, we will link to the Mike Slive Foundation in our show notes. Charles, your whole list of organizations where I don't know how you have enough hours of the day, we're going to list in the show notes as well. But I want to thank you both for lending your voices to this area. And again, making people out there who are listening know that they're not going through this alone and that there are other people who have been there, who've made it through, and there are resources and tools to help. So thank you both so much for being a part of the podcast club.
Thank you for having us, Molly.
Thank you so much for this opportunity. Special thanks to the Manta Cares team. Y'all have been wonderful to work with. And thank you again, Charles. It is always so wonderful to get to talk with you.
This episode was supported by an award from the Patient-Centered Outcomes Research Institute. This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.